Appendicitis and tonsillitis are two fairly common health problems, but many people don't understand what exactly they are or just how common these ailments are in children. So we asked our mid-morning pediatrician, Dr. Gigi Chawla from Children's Minnesota, to tell us about these illnesses, their symptoms, their treatments. Nice to have you with us this morning.
Thanks for having me back again.
Let's talk about appendicitis. This sounds extremely painful.
It usually is painful, and it's pretty difficult to miss because of the classic signs. Most of the time, kids will start with some nausea, some central belly pain, like right near the belly button.
There's a weird spot for belly pain,
yeah,
right?
well, actually, the belly button is probably the most common spot for belly pain, but then it migrates down into that right lower quadrant. And there's very few things in the right lower quadrant that we worry about other than the appendix. So that is most.
And you worry that can burst, right? The appendix?
Right. So the appendix is kind of a blind, almost like a little cul-de-sac of your intestines. And if something blocks the entry to that cul-de-sac, then everything behind it can get infected and swollen, and then doesn't have an exit track other than to potentially burst. So the important thing is that not all appendicitis requires surgery in order to treat. Now we're seeing more and more that antibiotics alone can be the answer.
And it works?
Yep.
Sometimes, yes.
Sometimes.
All right, so what about tonsillitis? Because as a kid, I heard you get your tonsils out, you get as much ice cream as you want. Is that still kind
Sounds awesome.
That probably still is the case, especially for families. But no, tonsillitis can be caused by lots of different things. I mean, I think most families understand that tonsillitis, can be associated with strep throat, but lots of different viruses can also cause tonsillitis. And it's that repetitive pattern that gets kids to the point where we think about taking those tonsils out.
What is tonsillitis exactly?
So your tonsils are the tissue kind of on the sides of the back of the throat that are the tissue that fights off infection, and so they're part of your first line of good defense, so that if you have a cold or an illness, it's where all of your own body starts to treat that illness, but sometimes it can take on a life of its own and get infected all on its own.
How common are these things for kids? I mean, are there age ranges that we worry about one or the other?
Yeah, I tend to think of tonsillitis as being between the ages of 6 up through all of young adulthood. And it happens very commonly, so we can see this on a weekly basis for sure. Appendicitis, about 1 in 200,000 people in the United States get it, but the most common ages are between like 10 and 20. And so really we think of that very commonly in our young school-age kids.
Anything we can do to prevent either of these things?
So for appendicitis, no, unfortunately.
Just
not much you can do to prevent it. For tonsillitis, really good hand washing, making sure that you're always trying to stay as healthy as possible that way.
Hand washing solves so many things.
It does.
It's
it
true.
Does. Keep up with it.
Very good. Gigi, thanks for coming in.
Thanks for having me.